Starting the recording. Welcome to the April 15th Sacramento County Public Health Briefing. It has been quite a week, so I think we have a lot to cover. I will go ahead and pass it over to Dr. Casirier.
Good morning, everyone, and thank you for joining us again. So briefly, where we're at with the numbers, we're at 100,726 cases of COVID-19 reported to Sacramento County Public Health and 1,644 deaths. We are averaging about 150 cases per day. And according to our dashboard, which is updated daily, our average case rate is 9.7 per 100,000. What we've seen over the last 2 weeks is that the numbers do continue to fluctuate up and down. And if you look at the blueprint update from Tuesday that was published from the CDPH website, Sacramento County showed a case rate of 7.8 per 100,000. So we are still in the red tier. We are not making progress yet towards the orange tier, but we are still very hopeful that the numbers will start trending down again, and that will allow us to be able to get to the orange tier. I'm sure you're all aware that earlier this week, the Centers for Disease Control and the FDA recommended to the states that they hold off using the Johnson & Johnson vaccine pending a detailed review of 6 cases of the same kind of rare but serious event, which was blood clot in the vessels that drain the blood from the brain. And this was combined with a drop in the platelets, which increases the risk of bleeding. And among the 6 deaths, 6 cases, there was 1 death. So we are still waiting as the review is ongoing. And so in alignment with that recommendation, as well as recommendation from CDPH, we sent out notice to all of our partners in Sacramento County that we were not going to use the Johnson & Johnson for now. So with that, I will pass it on to Rachel to give an update on our vaccine status, as well as talk about how we are working with pivoting from using the Johnson & Johnson.
I'll get to the allocation in just a moment, but as Dr. K said, we did have to make some changes in plans this week. So the day started early Tuesday when we received word that the Johnson & Johnson did need to be paused. I'm sure you're aware we had big events planned at Luther Burbank that day, and the next day at Liberty Towers, partnering with Dr. Rusty Yoshida from Urgent Care Now. So I did get an early call from him. He really wanted to keep the commitment to those sites, felt it would be tough to cancel at the very last minute. And so he looked at his inventory, we looked at our inventory and assessed the situation, and it looked like we were going to be able to shift doses around. And so he was able to take Pfizer to both of those sites and keep that commitment, which was really fantastic. Again, we shifted some doses around, and it looks like we're able to cover all of the clinics that we had scheduled this week. We did have some things down the line, I think next week and in the next 10 days that we were going to use Johnson & Johnson for. Some of those sites have chosen to hold off and are hoping to still be able to use Johnson & Johnson. So I think we'll continue to check with them, and if it seems appropriate, we will rebook with a different vaccine. And some of the ability to pivot quickly in a situation like this is because we have public health has a great relationship with our providers. Dr. Yoshida is one of them, but the other providers as well as the hospitals in the area. And so when there is a situation where there's a shortage of doses or someone needs a different kind or type of vaccine, there's just a real collaborative effort. So we're thankful to our partners for offering to assist this week. Very grateful for that. So, and just to give you an idea of the number of doses of Johnson & Johnson that have been administered in Sacramento County, it looks like to date, there have been 22,369 doses given. And in the last 2 weeks, that's 10,950 doses. We are encouraging providers and patients to enroll in VSafe, and we do hold a weekly call. I have it shortly after this meeting where we will remind them again that the CDC has an app, a phone app that you can scan a QR code, and then it does a daily check-in with you to see how you're doing after your vaccine. And we think this is a really important thing for providers to offer to patients to make sure that they are part of that safety monitoring. And also that any suspected adverse events should be reported into the VERS system, which is the CDC tracking for vaccine adverse events. And then I'll go to our allocation this week. Of course, we did not receive any Johnson & Johnson vaccine. No shipments are being sent at all from the CDC, but we still have a slight increase. It's 21,830 doses in total. That's 10,530 doses of Pfizer and 11,300 doses of Moderna. Thank you.
Okay, so that is our briefing today. We wanted to leave time for questions. So as a reminder, please stay on mute unless you are the one asking the question. And if we can go ahead and utilize the raise the hand feature in Zoom, or put in the chat if you are on Zoom, and I will call you. If you are strictly on the phone, please pop in at the end of another question. So we will go ahead and take questions now. If you guys want to go ahead and raise your hand. Okay, Michael, go ahead.
Hi, yeah, so I had two questions. First is circling back on something I asked a couple of weeks ago, which is that if Sac County has any details on whether there have been, or how many there may have been cases happening post full vaccination. And my second question is, how does the county plan to help kind of build back confidence in the Johnson & Johnson vaccine once it's paused, in the event that there is any hesitancy among people who may not want to get it after the CDC recommended the pause? Thanks.
Jamie, do you want to respond?
Yeah, so I can speak to the breakthrough cases. We had sent out a couple weeks ago some data from our CalReady surveillance system with those specific numbers. And since then, we have had our epidemiology team actually updated that table just yesterday. And they've been doing some work since it was over 80% missing in our CalReady system. So they've actually downloaded data from CARE, which is the California Immunization Registry, to try to cross-check those two data sources, and they're then inputting those data into our CalReady system so that we have a little bit better quality data. So I can have Jana send out that specific data table again to this entire group. That would be helpful. Yeah, but it's still a very small percentage. And then I would also caution that fully vaccinated is technically 2 weeks after you receive your final doses, and the way the data are calculated is it just shows that they've had 2 doses.
And I believe your second question was asking how we are going to work with the community to make sure that we address any vaccine hesitancy. Was that?
Yeah, specifically with the Johnson & Johnson, if there are people that are specifically concerned about it because it was put on pause.
Yes. So I think what's really important to stress is the fact that the system is working in terms of being able to report any adverse events and having the federal government review those cases, and also review to make sure that the vaccine that we are using is safe, or if there are any adjustments that we need to make in terms of who gets that vaccine, or what providers need to look out for if someone presents with symptoms, and also how to treat. So we do, and the message that we're giving out to our communities is that we should just be patient and wait until the review is complete so that we know what next steps we need to take. In terms of addressing the vaccine hesitancy, we continue to work with our community-based agencies and our partners in delivering the message about why it's important to get vaccinated, and also to put things in perspective. And I think this is something that's been repeated several times in the media, that the Johnson & Johnson has been used in about 7 million individuals within the United States, and we have 6 cases. So yes, these are serious cases, but when you look in perspective on what the risk is and compared to the risk for those same complications for people who get COVID-19, there's still a benefit for us to be able to continue vaccinating. So we're going to wait and find out what the guidance will be from the CDC and then move on from there. But definitely being able to work with our trusted messengers and partners in the community as we continue to message the importance of vaccination.
And
Chelsea Shannon from ABC 10. Oh, go ahead, Jamie. I'm sorry.
I was just going to say, I pulled up the data table that the EPI's put together. So if it's helpful to have a few numbers right now. So out of 30,421 people who were vaccinated between January 1 and April 13th of 2021, there were 2,002 who were at least partially vaccinated. Sorry, of those, that many cases from January 1 to April 13th, there were 2,002 that were at least partially vaccinated. And of those 2,002, only 92 were J&J doses.
Chelsea Shannon, ABC 10.
So Rachel, you mentioned the fact that the Johnson & Johnson vaccine clinics may be affected in the future. We are wondering, how are the Pfizer Moderna vaccination clinics going to be affected with this shift to using more of those vaccines in the coming weeks?
Yeah, so since we do still have constrained supply, it's always a little bit of a juggling act, but we did, even though we did not receive Johnson & Johnson this week, we did see a slight increase in the doses, and we continue to be told that we should see increased supply by the end of this month or early May. So hopefully for Moderna and Pfizer, we'll just keep seeing doses increase and won't. I'm pretty confident that we'll be able to juggle things around and make it work. But having more doses, which I know is our mantra every week, having more vaccine will make this possible.
Chris Hooks from Capital Public Radio.
Hey, my question is also J&J related, but specific to unhoused residents. How does the stoppage affect the county's efforts to getting doses into arms of unhoused residents in Sacramento County?
We are still discussing with the providers that have been doing that outreach. Some of the providers, such as Elica Health, have already pivoted and they're using Moderna. And we are discussing how to make sure that we incentivize the individuals that get vaccinated for the first dose to come back for the second dose, and also how to make it easy for them to get to that second dose. So we're still working out those details.
And then just a quick follow-up on that. Are there numbers that you guys have that of unhoused residents that the county is vaccinated so far?
Yes, I don't have that readily available, but we can definitely have Jana send it to you.
I can actually take that question really quick. I know that we just eclipsed 1,000 unhoused vaccinations just earlier this week, or maybe it was the end of last week, but I know that we've made it to at least 1,000 unhoused residents that have been vaccinated so far.
Thank you.
Renee Santos, CBS 13.
Good morning. What does our vaccination rate currently look like, and how does it compare to other counties that have already opened up vaccines ahead of today? Are we falling behind? Are we short on handing out those doses? Where do we currently stand right now with our rates?
So I can take a stab at that. This, as we've said before, we're getting out all of the vaccine that's been allocated to us. So we're moving the vaccine that's coming to us. There's been zero delay in getting vaccine out that's come, down to the Sacramento County Public Health Department or to our providers. Another thing is that not all counties are necessarily comparable. There are other counties that are a lot smaller. They have a whole lot fewer population. So if you're just looking at sheer proportion of persons who are vaccinated, it's a whole lot difference in terms of the total volume of people that are vaccinated. One other thing I would add is that a lot of people who are not residents of Sacramento County work in Sacramento County. They commute here. And as you know, when we first opened up vaccines, it was based on occupation and it was by county of where people worked. And so we've provided a ton of vaccine to other county residents. And I know that Hannah has even some specifics about what the county of residence is for those who've been vaccinated at our Cal Expo site.
Hi, Jamie, thank you, Hannah Alborg. I can just jump in, and we had done a looked at the data from January 7th to March 15th, and about 20% of those that had come through the Cal Expo site had been from out of Sacramento County.
Alex from Sacramento Bee.
Hi, yeah, as a follow-up. So, I was looking at the how many people we vaccinated this far in the county, right? And so if you just take the raw number and you assume that everyone who was getting the vaccine in Sacramento was a resident, right? You have about 52% of the population covered. So obviously that's not the case because many people who got vaccinated here do not live in Sacramento. I'm wondering for y'all, do you have like a number in your head, like a herd immunity percentage that the county is eyeing right now as like a sort of North Star goal? And sort of a related question, do you have a sense of when you might reach, whatever that herd immunity number is, 75%, 80%, when we might see, when we might hit that vaccination rate in Sacramento County?
I believe the estimates that have been provided by the state are that the hope is that by fall that we will get at that number, but it is very dependent on the flow of doses that we get. And then also we are aware that the Pfizer vaccine is going through the process of being approved for vaccinating younger children from 12 to 16. So that will add to the number that will need to be vaccinated. But again, the hope is that we will have a substantial number vaccinated by fall.
Chelsea, you have a follow-up question?
Yes, real quick, Hannah, with the 20% that went out of county, do you guys have a breakdown of which counties receive more or where people are coming from, like some of the top counties?
Sure, yeah, we can provide that. I'll just make sure that I run it through the EPI team, and then we will have Janice send that information out.
Then Jana, could I ask one more question?
Sure, go ahead.
How so far is the new rollout of eligibility going? I know it's really early, but is there any update on that?
I believe that the eligibility changed today, so I think we will know more as the day goes on. But we are aware that there is a pent-up demand for vaccine, and now adding those, especially the younger age group in school, we know that a lot of parents are very interested in getting their youths vaccinated. So we will continue to work with the doses that we have and get them out as soon as we get them. And I know that whenever we do publish additional appointments, those are grabbed up very quickly.
A follow-up question from Renee.
How does the county plan to handle the vaccines given to people outside of the county, like we saw with occupation? Do you foresee that being a concern going forward with eligibility opening up across the state essentially? Do we expect to see people from other areas coming to Sac County, or do we not expect to see that because it's over else?
There's probably going to be some of that, but our hope is that if all the other counties are getting more vaccine as well, that people in those counties will be able to access the vaccine in their own county rather than driving to Sacramento. One thing that we are focusing on is with the targeted clinics that we're having in the community, especially for the underserved. In those clinics, we actually have the community-based agencies do the registration and sign people up. And so it's not open and it's not readily accessible by people outside of those communities. So that's how we're trying to control and make sure that we get the vaccinations to especially those areas that are underserved.
Okay, I do not see any more hands raised or anyone in the chat. Is there anyone that is strictly on the phone that had any follow-up questions? Going once, going twice. So I'll just throw out a quick reminder. The majority of you on this meeting probably already got the invitation, but we are hosting a media availability at our Cal Expo location tomorrow at 10 a.m. To celebrate and transition our county public health team off of that location and onto other projects in the county. We're bringing in our operator Curative that currently runs the McClellan site to also operate the Cal Expo site. In addition to having that media event, part of the invitation was also that any of our media partners that were interested and had not yet been able to access a vaccine, that would be open to them at our event tomorrow as a way to not only get you vaccinated, but to combat vaccine hesitancy and show your viewers or your readers how easy and seamless the process is. So if that's something that you or your coworkers might be interested in to send somebody tomorrow, please reach out to me and we can facilitate that. Otherwise, as usual, I will send out the recording to this meeting within the hour, in addition to some of the other data points that were discussed on this call. And if we don't see you tomorrow, we will see you next Thursday. Thanks for joining us.